You know, there's so much information flying around out there about coronavirus, COVID-19, and I hate to say this, but there's a lot of false information out there, and people are believing it. So what we decided to do this morning is go to the experts. We've got Dr. Seth Rosenbaum, Chief Medical Officer and Infectious Disease Specialist at Robert Wood Johnson University Hospital Hamilton and RWJBarnabas Health Facility, with us on the phone this morning. Good morning.
Good morning, guys.
I want to thank you, first of all, for taking the time. I know you are super busy these days in the middle of all this. How are you doing?
We're doing fine. You know, we have a great team here at RWJ Hamilton that really makes it a lot easier to come to work knowing that they're providing the care to our patients that we expect them to do, and it makes it a lot easier as an administrator to know that the community is getting what they need in this time of crisis.
And we know that Hamilton Township and some of the surrounding areas just had a big recognition ceremony for all of you. So we here at PST want to say thank you, and we need you to help us do some myth busting here. Are you ready?
Mm-hmm. I am ready.
Okay, so I'm young. Can I get sick? A lot of younger people think they're kind of immune to all this because that's what we heard in the beginning.
Yeah, it's a good question, and it comes up quite often. You know, we're seeing the majority of our COVID-19 patients in the adult age bracket, but that doesn't exclude children from being infected. Some children have been infected with COVID-19. Although they don't appear to be at high risk for COVID-19 as much as adults, they still can get infected, and that also includes the younger population, the millennial population as well.
So if I don't feel well, you know, will I even be able to get a test?
We've heard there's a shortage.
Yeah, the testing capabilities are a big topic right now, and who's able to get tested and who will be supplying the tests. I'm happy to say that here at Hamilton, we're able to test all those that are appropriate to be tested. So, you know, most people that contract the virus probably won't need to be tested because they can be relatively asymptomatic, or they could be with few symptoms, and they're just expected to stay at home and monitor their symptoms and contact their healthcare provider. If they get worse, or if they feel like they're having trouble breathing, for that matter, then they would contact their healthcare provider. But that being said, if you need to be tested, there are certain criteria that need to be followed due to the limited amount of testing kits in the community.
And what is that criteria?
So some of the criteria that are out there are basically certain symptoms that a patient could be exhibiting. If you're an immunocompromised host, for that matter, such as someone with cancer or someone with a disease such as lupus or HIV, you're at higher risk for developing the virus and also developing more complications after acquiring the virus. Healthcare workers and employees are at high risk, as you very well know. They're on the front lines every day, so those people would be at higher priority to be tested at this time as well.
We're back this morning with Dr. Seth Rosenbaum. He's the Chief Medical Officer and Infectious Disease Specialist at Robert Wood Johnson University Hospital Hamilton, which is our RWJBarnabas Health Facility. It's great that you're here, Dr. Rosenbaum, because there's so much false information out there that we want to make sure our community was getting the right information. Now, something we've heard a lot is this Ibuprofen versus Tylenol thing. Can you tell us about that? What are we supposed to do?
Yeah, it's a very good question, and it's actually a myth buster, and we need to clarify here. You know, initially the FDA and some small studies showed that there might have been a negative outcome in patients that were infected with COVID-19 that were treated with ibuprofen, which, as you know, is Motrin, or Advil for that matter. However, recently the FDA came out and said there's really not enough information about whether the use of ibuprofen negatively affects COVID-19 patients. So at this time, if someone needs a fever-reducing agent or even a pain type of medication, the recommendation is really to try to use Tylenol, which is acetaminophen. However, you need to be careful in the dosages of Tylenol because they can be somewhat harmful if you use it in too high of a dose. At this time, you know, fever is our friend. You know, if your body is showing fevers, that's a sign that something bad is possibly happening. So we really don't want to reduce it too much.
Right. You want to fight it.
You want to correct.
Yeah.
So if you needed to use something, Tylenol would be the recommended agent at this time.
So obviously we see a lot of people going places wearing masks and wearing gloves. And I know there's a lot of controversy about that, especially because they leave them everywhere and they're littering them. But should we still be wearing those masks and gloves in public places?
And I worry about the cross-contamination with gloves.
Yeah, no, in light of the new data that came out about COVID-19 and how it spreads, the CDC actually now recommends that people wear what we call a cloth face covering to cover their nose and mouth, and whenever they go out in like a community setting or a public setting, i.e. if they go to a pharmacy or if they go to a supermarket to get groceries, it really it's recommended to wear a cloth face covering. We're not telling people to go out and wear what we wear in the hospital, an N95 respirator mask or one of these really heavy-duty surgical masks. A cloth mask would be sufficient for the lay person in the community to go out to do errands if they have to go out and do errands, because not only does it protect you from someone, but it also protects other people from getting the infection if you per se have it and you're asymptomatic.
And what about gloves? Yes or no?
No, gloves are really not required when you're going out to do public errands. The best way to protect the virus from coming onto you is washing your hands with good hand hygiene, whether it's with soap and water or using a hand sanitizer that's over 60% of alcohol. That's really the best way to prevent, the virus from tracking onto you. And like you said before, we're seeing people litter the streets and curbs with gloves everywhere, so it's not a good thing right now. So gloves are not required. No.
And, I did wear them to the grocery store a while ago, a couple weeks ago, and then I thought to myself, okay, well, now I've just touched my wallet with the gloves, and, the cross-contamination thing was kind of freaking me out.
Yeah. People, despite all the recommendations, you're still going to see people do what they want to do, unfortunately. But all we can do in the healthcare industry is apply what we know from evidence-based medicine and recommend things that we've seen have been helpful. And at this point, gloves really are not required. That being said, wearing a mask or face covering is.
Interesting.
Awesome.
Now, I know a lot of people are trying to support their local restaurants right now, but is getting takeout risky?
I get that question almost every day from friends and family, whether we can order food, because everyone's locked up at home, and
sure.
There's so much cooking that you could do.
Right.
But here's the deal: the virus really hasn't been studied to be transmitted through in the stomach, or the saliva and stomach acid are very good at killing the germs. So there's minimal risk of acquiring the virus vis-a-vis the food. However, the containers that they're placed in or the bags that they're placed in could very well be a mode of transmission. So we just recommend that you wash down, the containers, throw them out, and put the food onto one of your own containers or dishes. And obviously, at the end, wash your hands very good before and after eating.
We've got a few more questions for Dr. Seth Rosenbaum. He's the Chief Medical Officer and Infectious Disease Specialist at RWJ University Hospital Hamilton and RWJBarnabas Health Facility. So grocery shopping. If I haven't seen one opinion about it, I've seen a million opinions about it. Obviously we have to go, should we go? Because a lot of people aren't getting delivery slots because Instacart is all jammed up. So how often should you go? Tell us about grocery shopping. What's your opinion?
No, obviously, if food is an essential item that we need to have in our home, so we need to get it somehow. Obviously, if you can do online ordering or curbside pickup, like you mentioned, Chris, that would be the most optimal way of obtaining the food. But like you said, there are limited slots and people aren't able to get them. So if you happen to need to go shopping, we really want you to minimize those trips because that will minimize your exposure to the virus and people that could be possibly infected. So try to bulk, up your shopping into as few trips as possible.
Yeah. And now, what about wiping everything down when we get home? There's been videos. There's been so many different opinions about that. I like to wipe everything down when I get home.
Yeah.
My husband, not so much.
Yeah, people say that you should wash, especially the frozen items you can wash down. Produce you should obviously wash even before COVID-19. So if you have the items to wipe it down, sure, there's really no harm doing it. There's really no recommendation to do it, but it can't hurt at this time. But the thing that you really need to keep in mind is that if you do go shopping, social distancing needs to be enforced. You need to really stay at least 6 feet away from others while shopping, and especially in lines. You'll see a lot of the supermarkets have the little feet footprints on the floor to show people how far they should be spaced apart.
I think stores are doing a really good job at that. So when we're talking about COVID-19, I feel like myself and a lot of my friends, we're having a lot of anxiety about it. There's so many things that you hear. Like, what can we do to kind of push that anxiety down, feel a little better every day?
You know, I was actually watching CNN last night, and they were talking about the mental health aspect of COVID-19, and you know, it is a big concern. You know, this is a disruption in our normal life. People are not used to it, so you know, there are a lot of anxiety issues. There's a lot of stress management issues, and unfortunately, there's a lot of depression. So really, if you start to see any signs and symptoms of any of the above, you really need to contact your healthcare provider and not put it off, saying, "Oh, it'll get better." That being said, there's several apps, and you know, there's several web-based applications that can help you with stress management. It's really important to continue the interaction with people, even though you're kind of social distancing and somewhat of a lockdown. So you need to go on Zoom calls. You need to FaceTime friends and family. Check on your elders. Continually surround yourself, with bad news is not a good idea. So try to minimize what you're watching on the news, because we're getting a lot of mixed messages, and it kind of freaks people out at times. So that we try to minimize as much as you can by watching the news. You know
what's kind of freaking me out a little bit is now is like strong allergy time. So every time I cough, every time I have a little tickle, I'm like, oh my God, do I have it?
Right.
So what if I have the virus, or I think I have the virus, what do I do?
If you think you have the virus, obviously the first thing you need to do, like any other, medical condition, is to call your healthcare provider. Call them. They're the professional. They should be able to diagnose over the phone. They should be able to think clearly and see whether you have symptoms that are consistent with coronavirus. And they'll tell you the right next step, whether it is to be tested or whether it's to go to the emergency department or whether it's just to stay home. Majority of cases, like we talked about earlier, are mild, and the only thing you probably will need to do is self-quarantine yourself at home. And if symptoms worsen, obviously call your healthcare provider or go to the emergency room.
Yeah, I think people's first gut reaction is to go to the ER, but that's not the case here.
That's correct. Our ERs are over inundated with patients. You got to remember, just because we have COVID-19 going on, there's still patients with heart attacks and strokes, and gallbladder issues and appendix issues. So the regular bread and butter emergency department stuff is still going on top of what's going on with COVID-19.
All right, before we let you go, Dr. Rosenbaum, I want you to tell everybody where they can learn more about COVID-19.
Yeah, I think two places to go for COVID-19 information would be obviously the website for our hospital. That's www.rwjbh.org/COVID-19. And for rolling updates on COVID-19, I would recommend following the cdc.gov or even nj.gov/health. Those two would be very good places for information regarding COVID-19.
Dr. Seth Rosenbaum, Chief Medical Officer and Infectious Disease Specialist at RWJ University Hospital Hamilton and RWJBarnabas Health Facility. Thank you so much. There's so much false information going on around there. I wanted our listeners to have the right information. Thank you for all you're doing. Be safe, be well, and thanks for your time today.
Thank you very much, guys. Be well.